Autonomic nervous system. We're going to go over the autonomic nervous system and a little bit in detail about the autonomic nervous system before we go and understand the drugs. This will help us to understand drugs mechanism of action and the side effects, and it'll be really easy to remember as well. So let's take a look. The first line. Now you have seen this table and all this explanation probably many times when you're in a nursing school. Like sympathetic nervous system is fight or flight response, and parasympathetic nervous system is rest or and digest nervous system. And in sympathetic nervous system, heart rate's gonna go up, bronchial smooth muscles gonna relax, arteries gonna contract, salivary gland gonna be inhibit salivation. So all these things, you see here all the things here, and for the parasympathetic as well. Let's talk a little bit in detail for each one. So when the sympathetic nervous system activates and because of the fight or flight response, then you need a little bit more blood in your all the skeletal muscle and all in the body, because they need to produce the energy to counteract the threat that your body is anticipating. That's why the heart rate is going to go up. Now the bronchial muscles going to relax because your lung needs more air, oxygen. That's why the bronchial muscle is going to relax, and the airway is going to be a little bit more dilated, so your lungs can get more air. Artery is going to contract, so your blood pressure is going to go up, and that's how your skeletal muscles, most probably that you're going to use in the fight and flight response, can get more blood. Now salivary gland, GI tract muscle wall, GI sphincters, you don't really need GI system really active at this moment when you are your body or your senses are threatened and you need to act quickly. So this salivary can inhibit salivation. GI tract muscles gonna relax, so there won't be any peristalsis movements. GI sphincter is gonna contract. So that's why these three things gonna be inhibits the GI thing. Urinary bladder is gonna relax, so your urinary bladder can hold more urine. As well, the liver, you will need a lot more energy than you require in normal status. So glyconeogenesis and glycogenolysis gonna happen in liver, and the blood glucose level is gonna go up in order to produce the more energy. Kidney renin secretion is gonna happen, so renin is gonna start the RAA system, and your blood pressure will go up, and the fluid volume will go up as well in your body as well. And definitely sex organs gonna be inhibited as well. And it's totally opposite in the parasympathetic nervous system. So like a heart rate is gonna increase in sympathetic nervous system, it's gonna decrease in parasympathetic. Bronchial muscles gonna relax in sympathetic, it's gonna contract in parasympathetic nervous system. Now we have looked at this description a lot of time. Let's take a look into a little bit detail and see if we can break this thing down and understand a little bit in more detail. All right, so autonomic nervous system. Here's our brain. I'm not really a good painter, and here's our spinal cord. So there are two branches for autonomic nervous system. If you can, ANS, pre-ganglionic and post-ganglionic. Now you need to remember this. Not really remember, but understand in order to understand all the branches of parasympathetic and sympathetic nervous system, and as well as the drugs as well. So we have some neurons in central nervous system, which is here and all the way up to down, and the other neurons comes out of the spinal cord right here like that. Those are called peripheral nervous system. Peripheral nervous system, because they're not central, they're peripheral. Now, the neuron originates from the central nervous system. This is a neuron. This is axon. This is the body. This is body. This is axon of neuron. If you know the anatomy of the neuron, this is dendrites. So let's say this is sympathetic nervous system and this is parasympathetic nervous system. Here we go. This is the same neuron, dendrites. Okay. Now, this part in both SNS, sympathetic nervous system and parasympathetic nervous system, we're gonna say preganglionic neurons. These neurons are located in the central nervous system, not in the peripheral. Okay. Now there's another neuron axon. It's gonna be right here. And this is dendrites. And here is the target tissue. Target tissue. And here's a small. This is dendrites. And this is the target tissue. So this part, it's gonna be in the whole part. It's gonna be in central nervous system. And this part is peripheral nervous system. Okay. Now these neurons, like when these neurons get any kind of command from the brain, this neuron's gonna talk to this. This neuron's gonna talk to this neurons as well. Like from one, this one's gonna talk to this one. So this is preganglionic. This is postganglionic neurons. Now, the main point I wanted to tell you about this thing is this preganglionic neuron, which is located either in the brain or the spinal cord, are cholinergic. These are cholinergic. Okay, that means when this neurons gets excited, this is gonna secrete here a neurotransmitter ACH. I mean, that's acetylcholine. Same here. Doesn't matter if it is a sympathetic nervous system or parasympathetic nervous system. Now, if this neuron gets excited and secretes the acetylcholine and it talks to this second neuron, then if this is a sympathetic nervous system, this is gonna release the sympathetic nervous system neurotransmitter. If it is a parasympathetic nervous system, neurons is gonna secrete the parasympathetic nervous system neurotransmitter, which we're gonna talk about which neurotransmitter are for which nervous system in following slides. So this is kind of, I wanted to make a point. This like all preganglionic neurons are cholinergic, and all postganglionic neurons depends. Like if it is a sympathetic nervous system branch, it's gonna be adrenergic. If it is a parasympathetic, then it's cholinergic. So like if you take a look at like a parasympathetic nervous system, the preganglionic and postganglionic neurons are both gonna be cholinergic, while the sympathetic nervous system, the preganglionic neurons gonna be cholinergic and the postganglionic is gonna be adrenergic. All right, so let's take a look into each sympathetic nervous system, the sympathetic nervous system and parasympathetic nervous system in a little bit detail. So as we told, like this is just this diagram is basically explaining that we talked in the previous slide. Preganglionic, so this is kind of like a central nervous system. The preganglionic neurons are right there and the postganglionic neurons are right here. So sympathetic nervous system. The main neurotransmitter for the sympathetic nervous system are epinephrine and norepinephrine. They are also called as a catecholamine. Now, there are many names for sympathetic nervous system. Some would say adrenergic, as well. It's the same thing. So you can say adrenergic or sympathetic nervous system. They're both the same thing. And the neurotransmitters are main neurotransmitters for them. So like when I say neurotransmitter, means like one neuron talks to another neuron, like as we talked in, like this is a neuron. Now the neurons are not connected to each other, okay? If you remember anatomy and physiology. So if this neuron has to talk to this neuron, how does it talk? This neuron's gonna release the neurotransmitter right here from its dendrites right here, and this neurotransmitter is gonna go and attach to the axon of another neuron, and depending on which neurotransmitter is being secreted from the first neuron, the second neuron is gonna receive the message accordingly. Okay, now sympathetic nervous system. There are 4 different receptors for sympathetic nervous system. This is really important to remember, because this will help in the medication and to remember that which pharmacological class medications work which way and for which disease. So there are 4 receptors. Here the alpha receptors and beta receptors, and they're further divided in alpha 1, alpha 2, beta 1, and beta 2. Now where they are located. Alpha 1 are located into the all sympathetic organs excluding the heart. So this alpha 1 receptor you'll see mostly, you won't see in heart, but you will see in the vessels and liver and etc., like all other organs. Alpha 2 receptor, now this is kind of tricky. Alpha 2 receptors are located in central nervous system only, like they are not present in peripheral nervous system. So their neurons extend to the central nervous system to up to the brain only. And spinal cord SC. The beta 1 receptors are located on heart and kidneys, and beta 2 receptors are located on all sympathetic organs excluding heart, and they are located mainly in the bronchial and uterine vascular smooth muscles. Sorry, I forgot to write that one down right there. So if you remember this 4 things, it'll be much easier to understand the sympathetic nervous system drugs as well. All right, next slide. So we know these receptors are located on which organ. Let's talk about a little bit what will happen if we excite these receptors. So if you give a drug that goes and binds to specifically alpha 1 receptor, what will happen? It will cause the vasoconstriction. So it will do all the things that we looked into that first table in sympathetic nervous system, except increasing the heart rate, basically, because it's not present in heart. So vasoconstriction, increase in blood glucose level, and etc., like all the other sympathetic nervous system symptoms. Now when you excite this alpha 2 receptor, remember I told you in the previous slide, this is a little bit tricky. Now when we give any drugs that goes to the brain and spinal cord, means the central nervous system, and binds to these alpha 2 receptors, it decreases the epinephrine and norepinephrine level. So basically, what I'm saying is, when you give a drug that goes and binds to alpha 2 and potentiate its action, it actually decreases the sympathetic nervous system effect. So it's kind of opposite. Like when you excite alpha 2, it's going to decrease the sympathetic nervous system. Now beta 1, they're present in heart and kidney. So when you excite this, when you give a medication that's going to go and bind to beta 1, what is going to go and work on the heart and kidney? So it's going to increase the heart rate, force of contraction, of heart, and increase kidney blood flow. Because what this does is, like, when beta 2 gets excited by any drugs on kidneys, it actually dilates kidney blood vessel. Okay, now the last receptor is beta 2. Now this receptor is present in all organs except heart, and mainly in bronchial and uterine vascular smooth muscles. So it's gonna actually, when you give a drug that's gonna go and bind to the beta 2 specific receptor, it's gonna dilate the bronchial and uterine smooth muscle. Now at the same time, it's present in other organs as well, like liver, GI, and everything. So it's definitely gonna decrease the GI motility. It's gonna increase the blood glucose level, and etc. All effect you see when you excite sympathetic nervous system on the body. Now when you excite this beta 2, it's not gonna increase the heart rate, since those receptors are not present in the heart. So this is a basic explanation about all receptors that are present in our body, like sympathetic nervous system receptors, and all the drugs that we give for specific receptor has a specific effect depending on what receptor they bind to, and the side effects gonna be the things that we don't want. Let's say, for example, in beta 1, if we give a drugs that excite, that gonna go and bind to beta 1 receptor, now it's gonna actually bind to heart and kidney, but at the same time it may go to different organs and bind as well, and it's gonna cause the sympathetic activity, like a decrease in GI motility, increase in blood glucose level, and decrease in salivary glands production, so forth. Those are pretty much going to be the side effects. Okay, and we'll go and discuss each class in detail in the following videos. Now, parasympathetic nervous system. The main neurotransmitter present in parasympathetic nervous system is acetylcholine. And as we talked about in the very first slide, this is the central nervous system, the brain, and the spinal cord, and this goes to like a postganglionic neurons. So all the neurons are preganglionic, and these are all postganglionic neurons. So that's the parasympathetic nervous system. Now let's take a look at the receptors. Now there are only two kinds of receptors: muscarinic and nicotinic receptors. Now here is a thing: nicotinic receptor. You won't find these nicotinic receptors except the smooth muscles, in the smooth muscles in the postganglionic neurons. That's it. They're not in the heart, kidneys, or anywhere. While the most of the parasympathetic nervous system receptors are muscarinic receptors, like heart and all the targeted parasympathetic organs. So this one's kind of a little bit easy to remember compared to the sympathetic has a 4 receptor like alpha 1, alpha 2, beta 1, and beta 2. So that was it about the nervous system, parasympathetic nervous system, and sympathetic nervous system. Hope you find this helpful. We'll go and discuss each class in detail in the sympathetic nervous system drugs and parasympathetic nervous system drugs. Thanks for watching.